Published 13:16 Eastern Daylight Saving Time, the 22nd of May 2018. Updated 13:16 Eastern Daylight Saving Time, the 22nd of May 2018. Nurses working with the World Health Organization (WHO) prepare to administer vaccines at the town hall of Mbandaka on May 21, 2018 during the launch of the Ebola vaccination campaign. African health authorities said Tuesday they are preparing to send anthropologists to Democratic Republic of Congo to ensure a vaccination campaign against a deadly Ebola outbreak runs smoothly. If we do not handle communication well, the vaccination program may suffer, John Nkingasong, head of Africa Centers for Disease Control, Africa CDC, told reporters in Geneva. So we are also assessing how in the next 2 weeks or so to deploy anthropologists to support the vaccine efforts, he said. His comments came a day after the Congolese government began using a prototype vaccine as part of a bid to contain and roll back the outbreak that has killed 27 people. So far, there have been 51 cases since the outbreak was declared on May 8, it said. Of these, 28 cases have been confirmed, 21 are probable and 2 are suspected. One of the world's most notorious diseases, Ebola, is a virus-caused hemorrhagic fever that in extreme cases leads to fatal bleeding from internal organs, the mouth, eyes or ears. The outbreak began in rural northwestern DR Congo, in a remote location called Bikoro. Last Thursday, a first case was reported in Mbandaka, a city of around 1.2 million people that lies on the Congo River, where it is a transport hub to Brazzaville and Kinshasa downstream into Bangui, upstream. We continue to be very concerned, Nkingasong said. He said Africa CDC was in the process of deploying 25 epidemiologists to the affected areas to assist the World Health Organization, Doctors Without Borders, MSF, and others trying to stem the outbreak on the ground. He said China's CDC had also said it would send 5 staff, and the U.S. CDC had also indicated it was prepared to send in staff to help. But he acknowledged it remained unclear whether people on the ground would follow instructions on how to best protect themselves and others against the deadly virus. Nkingasong said Africa CDC was closely following how people reacted to the vaccination efforts to determine how many anthropologists were needed. We will be looking, especially based on what we learned from the first week of vaccination, what numbers will be appropriate, Nkingasong said. During the deadliest ever Ebola outbreak, which killed more than 11,300 people in 3 West African countries from 2013 to 2015, an initial lack of understanding of cultural norms by the first responders fueled suspicion on the ground. Many people refused to follow best practice instructions for reining in the outbreak. We are dealing with human behavior, Nkingasong said, adding, that is why we think that having anthropologists associated with Africa CDC's response is very critical. Sorry, we are not currently accepting comments on this article.